Hello again, I'm Dr. Sebastian Popescu, Maxillofacial Surgeon, and in today's video I'll show you exactly what to do step by step if you or your child loses a tooth in an accident. Please subscribe to our YouTube channel and share this video because you could save a smile. When a tooth is dislocated from its socket, and it may completely fall out of the mouth, time is critical and your response can make the difference between saving the tooth or losing it permanently. So stay calm and act quickly. If a child is involved, try to calm her or him down. Panicking or crying can make the situation harder to manage. There will be some bleeding. It's also possible that they may have injured their lip or tongue during this accident. They can gently bite on a gauze pad, a handkerchief, or a clean tissue to stop the bleeding. Find the tooth that was knocked out. If you located it, grab it only by the crown, the white part that is visible in the mouth. Do not touch the root under any circumstances. It is covered with cells vital for the tooth's reintegration. There might be sand or dirt on the root. This kind of accident often happens on a playground, sports field, or during a trip. It's unlikely you'll have sterile saline solution to clean the crown or the root, but you can use cold milk instead. Avoid using water. Do not use soap, do not scrub, and do not dry the tooth. From this point, there are two options. If the situation allows it, if you feel capable, if the child cooperates, in case the child is the one who suffered the accident, after the tooth has been cleaned a little bit using saline solution or milk, you can attempt immediate reimplantation. That means trying to place the tooth back into the socket. Ideally, the socket should also be gently rinsed with saline solution before reimplantation. However, don't get discouraged if you don't have saline solution, a sterile gauze, or gloves. I strongly believe that immediate reimplantation at the scene of the accident offers the highest chances of successful reintegration, even if the tooth is not perfectly aligned exactly as it was before. This can be fixed later. The younger the patient, the less time the tooth has been out of the socket, the faster and more precisely these measures are carried out, the greater the chances of successful reimplantation. In any case, you must urgently head to a dental or maxillofacial surgery clinic or to a hospital if there are any additional traumatic injuries. During this time, the patient should firmly bite on a gauze pad or clean tissue, holding the tooth in place. If for any reason you're unable to reimplant the tooth immediately, and by immediately I mean within the first 2 or 3 minutes after the accident, you must head quickly to a specialized clinic. Until you get there, the tooth must be kept moist at all times in a clean container. After picking up the tooth from the ground, holding it only by the crown and not the root, if the root is dirty, rinse it with saline solution or milk. If you don't have any, leave the tooth as it is, don't rinse it with water. Most likely, you'll find a cup or a bottle cap. The patient should spit into it. There will be some blood as well, but that's not a problem. Place the tooth inside, making sure it is fully submerged under the patient's saliva. I do not recommend that the patient keeps the tooth in their mouth on the way to the clinic, as she or he might accidentally swallow it. That may be a last resort option only if there's absolutely nothing else available to keep the tooth in. Do not keep the tooth in a tissue and don't hold it in your hand until you get to the clinic. I would not recommend you going first to get an x-ray. That can be done after the dental clinic visit. If you arrive at the dental clinic and the tooth is reimplanted within the first 20 or 30 minutes, the chances of successful reintegration are high. However, this doesn't mean that if you arrive after an hour or even later, reimplantation shouldn't still be attempted. In case anesthesia is performed by the doctor, I would not recommend using an anesthetic that contains adrenaline. It is a vasoconstrictor that reduces local blood flow, and we need as much vascularization as possible around the dental socket. After reimplantation, the dentist will immobilize the tooth. Local antiseptic cleaning and a thorough examination will be performed to identify any additional injuries. A quick professional dental cleaning, including scaling and polishing, can also be helpful. Pain relief, anti-inflammatory, and antibiotic treatment will be prescribed, along with tetanus prophylaxis if needed, depending on the patient's vaccination status and the nature of the wound. The patient must maintain a perfect oral hygiene and follow a soft diet for the first 2 or 3 weeks, avoiding any additional trauma to the teeth and gums. A panoramic x-ray will be taken, focusing on the reimplanted tooth. This x-ray will help assess the integrity of the tooth and the neighboring teeth and detect any possible fractures in the maxillary bones. Your dentist will continue to monitor the tooth over time because there's a higher risk of pulp necrosis, which may require a root canal, and also a higher risk of root resorption. According to medical books, reimplantation is now recommended for patients who are immunocompromised, have severe heart conditions, advanced periodontal disease, or for severely decayed teeth, or in the case of primary teeth. Indeed, baby teeth should not be reimplanted, but to take that decision, it's important to know the difference between primary and permanent teeth. Permanent teeth usually starting to erupt around age 6. However, if the little patient is around 5 years old and the evolved tooth is an incisor, I will recommend the reimplantation, especially if the root is now resorbed, as in the case of baby teeth that are about to be replaced. That tooth might actually be a permanent incisor in a child with an early eruption of permanent dentition. There are situations where, due to an accident, the tooth is not fully knocked out of the socket, but is instead rotated, tilted, or appears partially displaced. In such cases, it can be gently repositioned either at the scene of the accident or as soon as possible in a dental clinic, following the previously mentioned protocol. In other cases, a portion, small or large, of the crown may be fractured. If you found the broken piece, head as soon as possible to a dental clinic. Under certain circumstances, it may be reattached to the remaining tooth structure. So remember, your quick response can make all the difference. If you act correctly and without delay, your tooth or your child's can be saved. Don't forget to subscribe to our YouTube channel and share this video because you could save a smile. Send us a message if you found this information helpful. See you soon.